In this lesson, we are going to see what is a medical kit and when and where it is necessary to prepare and bring a medical kit with you during your travel. You will also learn how to compose your personal medical kit, taking in consideration your necessities together with the destination of your travel. In the end, we are going to give you an example of medical kit. We can call medical kit a starter pack of essential drugs and medical items. When leaving for destination, it's always recommended to carry a medical kit with you. You may need it in several different situations, from the most ordinary to the less unpredictable ones. Your kit should be based on the type and duration of the travel. It's better to choose medication that have already been used without problems in order to avoid eventual allergic reactions. A letterhead signed by the physician should accompany certain categories of prescription medicine in order to certify that those specific medications are required for medical condition of the traveler. It is advisable to bring the medical kit in the hand luggage in order to avoid having to interrupt a medical treatment in case of the loss of the whole baggage. A medical kit should be carried for all destinations. You can pack meds you need, taking in consideration illnesses you suffer the most or most frequently, such as headache, cough, sore throat, fever. In these cases, you may avoid the annoying research of your specific medicament in a foreign country where different drugs and different active pharmacological formulas may be in commerce. If you are already aware to suffer any allergy, you better prevent allergic reaction using drugs you've already tasted. In plus, drugs that in your country can be taken without a letterhead in a foreign country must be taken under medical prescription. Bringing a medical kit, it is important in places there may be significant health risks, like developing countries and/or places where the local availability of specific medication is not assured, because it allows to treat first symptoms of diseases before going to the hospital. The most common illnesses that may affect travelers are divided in 4 categories. Common gastrointestinal issues such as infectious diarrhea, constipation, nausea, and gastroesophageal reflux disease represent an increasing risk. 8% of the common illnesses of international travelers are represented by respiratory diseases, usually upper or lower respiratory tract infections. Traveler-related skin conditions occur in 12% of situations, such as contact dermatitis from plants, toxins, bacterial skin infections, and fungal infections. Finally, minor or major injuries are always possible, mostly in wild places or in areas with natural adversity. So, medical kit will include basic medicines to treat common ailments. Antidiarrheal medication is fundamental for some destinations like tropical areas against gastrointestinal sicknesses. Bronchodilator spray inhalers are crucial in case of respiratory crisis or illnesses. In case of severe allergy and if epinephrine has been prescribed by your own doctor, it is better to bring epinephrine auto-injector, for example an EpiPen, to make easier the assumption in case of emergency. Cortisone or antibiotic ointment could be used in the very first moment of presentation of dermatitis and on an infected wound before going to a medical center. First aid articles, which are essential in case of minor injuries. Some travelers may have special need due to their hair status. If the traveler has a chronic pathology, it's recommended to bring all the drugs he habitually assumes and make sure they're durable for all the holiday period. This is important to avoid problems in finding drugs in a local pharmacy. For example, some active principles are not marketed in old world countries or they are available in different dosage. Remember also that in some countries you may also need not only a letterhead signed by a physician, but also an additional certificate by the National Health Administration. When traveling to developing countries, you better also carry with you toilet items in quantity sufficient to cover your entire visit, unless you have collected information about their availability in your travel destination. Your list of toilet items should include items for dental care, eye care, contact lenses included, skin care, and personal hygiene. Bringing with you soaps with disinfectant for washing wounds when contamination is suspected is recommended as a good behavior norm. Now let's see together contents of Basic Medical Kit. Basic Medical Kit consists of first aid items such as antiseptic wound cleanser or alkaline soap, bandages, emollients, for example lubricants such as A-drops, insect repellent, insect bite treatment, antihistamine tablets, nasal decongestant, simple analgesic, for example paracetamol, clinical thermometer, sunscreen, adhesive strips to close mold wounds.